ਓਨਟਾਰੀਓ ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਫਸਰ ਡਾਕਟਰ ਕਿਰਨ ਮੂਰ ਨੇ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ ਕੋਵਿਡ-19 ਟੈਸਟਿੰਗ ਅਤੇ ਆਈਸੋਲੇਸ਼ਨ ਦਿਸ਼ਾ ਨਿਰਦੇਸ਼ਾਂ ਵਿੱਚ ਤਬਦੀਲੀਆਂ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ ਹੈ। ਉਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ 31 ਦਸੰਬਰ ਤੋਂ ਜਨਤਕ ਤੌਰ ਤੇ ਫੰਡ ਪ੍ਰਾਪਤ PCR ਟੈਸਟ ਸਿਰਫ ਉੱਚ ਜੋਖਮ ਵਾਲੇ ਵਿਅਕਤੀਆਂ ਲਈ ਉਪਲਬਧ ਹੋਣਗੇ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਉਹਨਾਂ ਵੱਲੋਂ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਗਈ ਕਿ ਸੂਬਾ ਸਰਕਾਰ ਵੱਲੋਂ ਆਈਸੋਲੇਸ਼ਨ ਮਿਆਦ 10 ਦਿਨਾਂ ਤੋਂ ਘਟਾ ਕੇ 5 ਦਿਨ ਕਰ ਦਿੱਤੀ ਗਈ ਹੈ।
Preliminary findings from Public Health Ontario suggest Omicron is the first dominant variant to demonstrate a decline in disease severity. The risk of hospitalization or death was 54% lower for Omicron cases as compared to Delta cases. While this is good news, because Omicron is much more transmissible, it is expected that the number of hospitalizations and impacts on the healthcare system will be significant. December 31st, publicly funded PCR testing will only be available for those vulnerable individuals, including those with significant medical issues who are symptomatic or at risk of severe disease from COVID-19, including for the purposes of confirming a COVID diagnosis prior to beginning treatments, and workers, residents, and others in the highest risk settings, such as hospitals, long-term care, retirement homes, and congregate living settings. In addition, most individuals with a positive result from a rapid antigen test will no longer be required or encouraged to get a confirmatory PCR or rapid molecular test. And there will be no testing for asymptomatic individuals in the community. Ontario is also changing the required isolation period based on growing evidence that generally healthy people with COVID-19 are most infectious for the 2 days before their symptoms develop and for 3 days after their symptoms. Individuals who are vaccinated, as well as children under 12, will be required to isolate for 5 days from following the onset of symptoms. This also applies to their immediate household contacts. The isolation can end after 5 days if symptoms are resolved or improving for at least 24 hours, and all public health and safety measures such as masking and physical distancing are followed.
ਨੋਵਾ ਸਕੋਸ਼ੀਆ ਸਰਕਾਰ ਵੱਲੋਂ ਘੋਸ਼ਣਾ ਕੀਤੀ ਗਈ ਕਿ 3 ਜਨਵਰੀ ਤੋਂ ਸੂਬਾ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਬੂਸਟਰ ਖੁਰਾਕਾਂ ਲਈ ਯੋਗਤਾ ਨੂੰ ਵਧਾ ਰਿਹਾ ਹੈ। ਨੋਵਾ ਸਕੋਸ਼ੀਆ ਦੇ ਪ੍ਰੀਮੀਅਰ ਨੇ ਇੱਕ ਵਰਚੁਅਲ ਨਿਊਜ਼ ਕਾਨਫਰੰਸ ਵਿੱਚ ਦੱਸਿਆ ਕਿ 3 ਜਨਵਰੀ ਤੋਂ 30 ਸਾਲ ਅਤੇ ਇਸ ਤੋਂ ਵੱਧ ਉਮਰ ਦੇ ਲੋਕ ਬੂਸਟਰ ਡੋਜ਼ ਪ੍ਰਾਪਤ ਕਰ ਸਕਣਗੇ। ਇਸ ਦੌਰਾਨ ਉਹਨਾਂ ਨਾਲ ਸੂਬੇ ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਵੀ ਹਾਜ਼ਰ ਸਨ।
When you think of the number of cases and add in their close contacts, tens of thousands of Nova Scotians have been impacted by the virus over just the last few weeks. This has put pressure on so many organizations, and you only need to look at the situation with the airlines to see the wrinkle effect of isolation and illness. Our healthcare professionals in the healthcare system are no different. This is a massive challenge in a system that is already severely understaffed. Our people are stretched thin. They're giving it their all. They're going above and beyond. So now we, as Nova Scotians, must match their determination and do our part so that they can do their job. This means some changes. No one likes change, but the world has changed since the beginning of the pandemic. The variants have changed. The vaccinations have been a game changer. And now we must also accept the reality in front of us. And that means change. First, it means that each of us has to take more personal responsibility. With stretched resources, we must ask Nova Scotians to take more personal responsibility. It's just that simple. I know everyone is eager to get their booster shot, but on boosters, we're sticking with the NACI recommendation that the booster is most effective 6 months after your second dose. We're sticking with NACI on that. I told you before Christmas that we needed a supply of boosters, kind of laid out where we were. I want to thank the federal government for coming through with the supplies we need. We reached out to the federal government. We made an ask. There's been a number of discussions. They've been extremely accommodating. They're coming through with shipments arriving during the month of January. We expect to have the supply we need. This is incredible. And I can't express how appreciative we are to Minister Duclos, Minister LeBlanc, and the Prime Minister directly for their support. We've had a lot of support through the system, including our local MPs. So I thank them for that. But let's talk about where we are as of today, knowing the supply situation. So with the supply now available, we will open up a couple 100,000 new appointments on Monday. We feel the urgency, and the team is working hard to add even more appointments. But to add more appointments, we have to overcome two remaining challenges. First, we need more people. We need people to help actually get those vaccines in arms. This is our biggest hurdle, especially now that we have an extreme shortage and pressure of healthcare workers not in the healthcare system.
ਕਿਊਬਿਕ ਸੂਬੇ ਅੰਦਰ ਲਗਾਤਾਰ ਵਧ ਰਹੇ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਦੇ ਕੇਸਾਂ ਕਾਰਨ ਸੂਬਾ ਸਰਕਾਰ ਵੱਲੋਂ ਸਖਤ ਪਾਬੰਦੀਆਂ ਦਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ। ਕਿਊਬਿਕ ਦੇ ਪ੍ਰੀਮੀਅਰ ਨੇ ਘੋਸ਼ਣਾ ਕੀਤੀ ਕਿ ਸੂਬੇ ਅੰਦਰ ਰਾਤ 10 ਵਜੇ ਤੋਂ ਸਵੇਰੇ 5 ਵਜੇ ਤੱਕ ਦਾ ਨਾਈਟ ਕਰਫਿਊ ਦੁਬਾਰਾ ਲਗਾਇਆ ਜਾਵੇਗਾ। ਲਗਾਈਆਂ ਜਾ ਰਹੀਆਂ ਹੋਰ ਪਾਬੰਦੀਆਂ ਵਿੱਚ ਡਿਲੀਵਰੀ ਅਤੇ ਟੇਕ ਆਊਟ ਨੂੰ ਛੱਡ ਕੇ ਸਾਰੇ ਰੈਸਟੋਰੈਂਟਾਂ ਨੂੰ ਬੰਦ ਕਰਨਾ ਵੀ ਸ਼ਾਮਲ ਹੈ। ਜ਼ਿਕਰਯੋਗ ਹੈ ਕਿ ਪ੍ਰੋਵਿੰਸ ਨੇ ਵੀਰਵਾਰ ਨੂੰ ਰਿਕਾਰਡ ਤੋੜ 14,188 ਨਵੇਂ ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਹਨ।
Our experts tell us that there's a risk that we won't be able to treat all those who need it in the coming weeks. I know we're all tired, but it's my responsibility to protect ourselves from this. This is why I'm announcing new restrictions starting tomorrow. Restaurants will have to close except for deliveries and takeout. Private gatherings in homes will now be prohibited, except for caregivers and for people living alone. I'm also announcing a curfew from 10 p.m. to 5 a.m. starting tomorrow night. Unfortunately, all indoor sports will have to stop. Places of worship will have to close except for funerals limited to 25 people, and teleworking remains mandatory. School, CEGEP, and universities will remain closed until January the 17th. Regular daycare will remain open, and school daycare services will remain open, but only for essential workers. I also have a message for the people who work in our health system. More than ever, Quebec needs you to provide health care to those who need it. We ask everyone who can to come and help your colleagues. We also have a shortage of employees in stores, including essential ones. This is why we've also decided to close stores for the next 3 Sundays. This will help shops that are short of employees. I also ask everyone to get their 3rd dose of vaccine as soon as possible. That makes all the difference. I know that the restrictions are difficult, and I know there's a lot of anxiety. If you're not feeling well, it's important to ask for help. We have to take care of each other, but I still want to wish all Quebecers health and happier news for 2022. Thank you.
ਸਸਕੈਚਵਾਨ ਦੇ ਪ੍ਰੀਮੀਅਰ ਸਕਾਟ ਮੋ ਅਤੇ ਸੂਬਾਈ ਸਿਹਤ ਮੰਤਰੀ ਪੋਲ ਮੈਰੀਮੈਨ ਨੇ ਸੂਬੇ ਅੰਦਰ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਦੇ ਵੱਧਦੇ ਹੋਏ ਪ੍ਰਸਾਰ ਨੂੰ ਦੇਖਦਿਆਂ ਸੂਬੇ ਦੇ ਸੋਧੇ ਹੋਏ ਕੋਵਿਡ-19 ਕੇਸ ਪ੍ਰਬੰਧਨ ਅਤੇ ਟੈਸਟਿੰਗ ਗਾਈਡਲਾਈਨਸ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਰੈਪਿਡ ਐਂਟੀਜਨ ਟੈਸਟਿੰਗ ਕਿੱਟਾਂ ਹੁਣ ਪੂਰੇ ਸੂਬੇ ਵਿੱਚ ਉਪਲਬਧ ਹਨ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਜੇਕਰ ਕਿਸੇ ਨੂੰ ਕੋਵਿਡ-19 ਦੇ ਲੱਛਣ ਮਹਿਸੂਸ ਹੁੰਦੇ ਹਨ ਤਾਂ ਉਹ ਤੁਰੰਤ ਆਪਣੇ ਆਪ ਨੂੰ ਸੈਲਫ ਆਈਸੋਲੇਟ ਕਰ ਲਵੇ।
You should also, while you're out, pick up some rapid tests. As I said a week ago, you should have those tests at your home, and you should test yourself from time to time. If you're feeling a little unwell, for instance, you should run a test. If you're going out to see or be with a group of people, you should test yourself before you do so. This is very much a large part of our offensive strategy as we look ahead through the next number of weeks and months. Saskatchewan is also one of the leaders in the country when it comes to the distribution of these rapid tests, and Marlo might speak more to that in some of the questions here today. The test kits are widely available in many locations, many locations across the province. So again, if you haven't done so already, go out and pick up a rapid test kit. Have those 5 or 6 tests available in your home for you and your family. We're in a place now in Saskatchewan where we really have unprecedented testing capacity. We have our public PCR tests that are available that we've had since the beginning. Those are available for people that are symptomatic. We have our private, both PCR and rapid testing capacity that is available across this province. Many are utilizing that for proof of negative tests that are certified, as well as if they're traveling, for instance. And now we have today 12.6 million rapid tests, self-rapid tests that are available in this province. Up until today, we've been telling you that if you test positive with a rapid test, that you should then go get a PCR test to confirm that result. And we're saying today that is no longer necessary. If you test positive, you should assume that you have COVID, and you should immediately self-isolate. The Saskatchewan Health Authority will continue to offer those PCR testing sites across the province as an option for anyone who is experiencing symptoms, and we for sure would encourage people to avail themselves to that if they do have symptoms. But as rapid tests are becoming much more commonplace,
ਪ੍ਰਿੰਸ ਐਡਵਰਡ ਆਈਲੈਂਡ ਦੇ ਪ੍ਰੀਮੀਅਰ ਡੈਨਿਸ ਕਿੰਗ ਅਤੇ PEI ਦੇ ਮੁੱਖ ਜਨ ਸਿਹਤ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਹੀਥਰ ਮੋਰਿਸਨ ਨੇ ਚੱਲ ਰਹੀ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਲਈ ਸੂਬੇ ਦੇ ਜਵਾਬ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ। ਡਾਕਟਰ ਮੋਰਿਸਨ ਨੇ ਦੱਸਿਆ ਕਿ ਸੂਬੇ ਅੰਦਰ 169 ਕੋਵਿਡ-19 ਦੇ ਨਵੇਂ ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਹੈ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਪ੍ਰੀਮੀਅਰ ਕਿੰਗ ਨੇ ਕਈ ਸਹਾਇਤਾ ਪ੍ਰੋਗਰਾਮਾਂ ਨੂੰ ਮੁੜ ਖੋਲ੍ਹਣ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ, ਜਿਸ ਵਿੱਚ ਤਾਜ਼ਾ ਸਿਹਤ ਪਾਬੰਦੀਆਂ ਦੁਆਰਾ ਪ੍ਰਭਾਵਿਤ ਕਰਮਚਾਰੀਆਂ ਲਈ $500 ਦਾ ਐਮਰਜੈਂਸੀ ਭੁਗਤਾਨ ਵੀ ਸ਼ਾਮਲ ਹੈ।
Just with some of that in mind, one of the impacts that we are most likely to see in the coming days and weeks may not just be in the form of hospitalizations, but in absenteeism. As more people test positive and as well as their close contacts needing to isolate to do their part to stop the spread of the virus, we're going to see some absenteeism around all parts of Prince Edward Island, and that's something we're trying to get prepared for and to be ready to address, and to assure that essential services are maintained in our province. We have activated an integrated response team made up of senior officials from CPHO, Health PEI, and other government departments to ensure that government programs and services are not disrupted over the coming weeks, days, and months. This planning includes prioritizing essential services such as programs to vulnerable islanders, ensuring payments and support programs are administered without interruption, all the while ensuring that the safety and well-being of both islanders and our public service are maintained as we continue to offer these important services. We have asked each department to renew and enact their business continuity plans in the last few days, as well as to identify staff who could be redeployed to essential service areas across government so that we can maintain these services for islanders. As well, all government employees who can are and will continue to work from home to limit the spread inside of government and beyond. At this time, no essential services have been impacted. The majority of public service is being asked to work from home, as I said, where possible, and where in-person work is required, the same measures we've had in place at the beginning of this pandemic and throughout are being asked to continue to be emphasized, that being the cohorting of staff, maintaining physical distance, and mandatory masking in workplaces and public spaces.